name's Polly Davis and I am a highly specialist speech and language therapist. My specialism is complex needs and neurodiversity, and I work for a company called Happy Talk Limited. If you're interested in us, come and find us over there. We're just at the stall over yonder. So today, I'm back. Yeah. Today, I'm going to be talking to you about how we amplify autistic voices and value lived experience as therapy professionals. The talk's going to focus on the lived experiences of autistic individuals and their families, communities and care providers, all about how we think about communication and experiences of accessing support. We're going to focus on how autistic individuals and families feel services can provide support which is safe, caring and empowering for them. We're also going to reflect on how professionals can learn from these experiences to build neurodiversity affirming services and communities. So why do we value lived experience? You can see here a little triangle I've got. This triangle I've taken from the American Speech and Hearing Association, who are kind of like speech therapists, but in the States. And it thinks about when we use evidence-based, what do we need and what do we consider as evidence-based practice? You can see there we've got our clinical expertise, and clinical expertise is very important, and I would never want to undermine our clinical knowledge. But sometimes clinicians can miss the nuances of what it's like to actually live and exist day to day as a neurodivergent individual or family. Neurodivergent individuals and families have an awful lot of knowledge about their own experiences because you have to learn to be your own advocate and often an educator for yourself or your child or your sibling or whoever it is. And I know this myself because as well as being a clinician, I'm also autistic and an ADHDer. Lived experience is brilliant because it also allows us to co-produce goals and co-produce work. Co-production refers to the process of involving the service user and their family, friends, loved ones, whoever's around them, in making those goals, making that plan and deciding what interventions we are and are not going to use. Lived experience is also brilliant because it tells us how each individual has their own unique areas of strength and unique areas where they need support. We value lived experience because we know so often it is not valued. An awful lot of service users and families report feeling really frustrated, dissatisfied, invalidated or ignored when trying to access support. There's a little word cloud here. This word cloud is verbatim responses collected from some of the families that I've spoken to about what their experiences of accessing support has been like. And the main thing people say is that it is frustrating. And I think we know this and we hear about this a lot in the media as well, that these services are not necessarily seeing families and children along the timeline that works for them and not necessarily providing the support that families want. So what are we doing to address this? We recently started a bit of a survey and a bit of a focus group project where we're bringing together neurodivergent individuals and their support networks to try and reflect on their experiences of accessing care and what works for them. So I've got a few of our findings here that I hope to talk you through. I'm going to read them more or less verbatim because not everybody is able to read words written on a screen like this. And again, these are direct quotes from autistic individuals and autistic parents. So the first thing we heard is that mental health support workers are amazing. Mental health support is so important and we should think holistically, whether we're in an education setting or we're in a public service or we're in a prison, wherever we are, we need to be looking at the mental health impact on the entire family or entire support network of the neurodivergence and of the trauma that we know that neurodivergent people are much more likely to experience. Similarly, people spoke about good experiences with clinical psychologists, and they spoke about clinicians being accommodating for their needs. We had somebody who said not a set number of sessions was really, really helpful. As opposed to using a really short episode of care, providing a bit more of an open-ended intervention can allow that person the time that they need to get used to the professional that they're with, to feel comfortable and to feel safe and to build that rapport. It also allows us to be flexible because we know some young people really, really don't like to engage for more than 5 to 10 minutes at a time. And if we've said you've got 6 sessions of 5 minutes, that's very little time over the course of that block. Somebody said that they feel it's helpful when clinicians listen to them. This is fundamental. We should always be listening to lived experience and we should always be learning from it. Somebody spoke about having done their own research. We know that an awful lot of neurodivergent people, when they access diagnosis or they start to look at self-diagnosis, can develop a bit of a special interest in neurodiversity. We are often the experts in ourselves and our own care because we have to be, because we might have waited a long time to get the support. So often we do it ourselves. Somebody spoke about extended deadlines in educational settings. This might be additional time for coursework. It might be additional times in exams. This is something I accessed myself at university, and it was life-changing. I went from falling behind on all of my work to achieving really good grades when I was just given that little bit of extra time to get things done. Somebody spoke about peer support. Peer support is incredible, whether that's a parent group, a service user group, whatever it is. Having other people around you who can value and understand what you're going through can be really transformational. Somebody else said, I was able to get advice on procrastination, organisation and time management. I think this is something that we often don't think of therapists being able to provide, but actually some of these skills around executive function are really, really important. And what we can do when we teach people things like organisational and time management skills is allow them to start advocating for themselves. Somebody else said that the therapists were very understanding of their issues and encouraged them to pursue diagnosis. This is crucial. Therapists should be signposting. Even if we ourselves cannot provide that diagnosis, where we feel it is needed, we should be saying, go and look into it and here is who can help you. Things only work when all the people, all the multidisciplinary team around an individual are singing from the same song sheet. Someone spoke about health passports. Health passports are an amazing initiative that health services use where they document the neurodivergent individual's needs so that if they're accessing hospital or primary care, those needs are on the system and people know how to communicate with them. Somebody else spoke about electronic devices to help them. Electronic devices and reasonable adjustments are amazing. I use them myself. I've got a paper tablet which allows me to move all of my notes onto a computer as opposed to having to type them up. And that's been life-changing for my ADHD. Someone else spoke about being able to access the right to choose. The right to choose initiative allows you to potentially bypass a really long waiting time by speaking to your GP and saying you want to be seen by a different service. Someone else spoke to us about actually just being asked what support might you need and asked yourself that question. And it's heartbreaking to think that sometimes autistic or ADHD or neurodivergent individuals aren't being asked what would help you. They also spoke about what would help in the future. And I think this is important too. Even those of us who primarily work with children and young people, children do not stay children forever. And we need to be future-proofing our services. We need to be thinking about independence and what that person will need in 6 months, 2 years, 5 years' time. How can we start building that now? We also, I'll wait for the applause to stop. We also spoke with families about what they want from services. And these are some of the things we were told. Somebody said more sweetness and reasonable adjustments. They want clinicians who are kind and respectful. Somebody spoke to us about better understanding of neurodiversity in girls. This is so crucial. Many people still have an outdated view of autism, especially as being something that is seen in young boys and young boys only. Somebody else asked for education, understanding and patience. And I think patience here is one of the key words. We need to give people time to open up to us and we need to give people time to build that therapeutic relationship. Somebody else said to us they want less parent blaming and shaming and thinking about what adjustments are required for an individual because not one size fits all. I think this is really important. So many parents I speak to talk about feeling so ashamed, being told that they are not doing enough for their family and their child and not being provided with that wellbeing support for themselves. Someone else also said that therapists need to be more creative about how the voice of the child can be captured. As speech therapists, I like to think we're generally quite good at this. We understand that voice of the child does not just mean ask them, how do you feel about your disability? It means using AAC, using visuals, using art materials, whatever way works for that child to help them speak about and understand their own condition. We asked as well, what do our survey participants wish others knew about their family members' experience of neurodivergence? We were told people want people to know what support is out there and available because so often these families and these individuals are left to figure it out by themselves. They want people to know that things that seem small and insignificant to a neurotypical person can be huge hurdles to neurodivergent people. It's all about personal experience and perspective. Someone said they want people to know that everyone is different. And I think about this a lot. You've met one autistic child and you've met one autistic child. You cannot use that to assume that every autistic child will be the same. Someone said they wanted people to know that they're not stupid and they just need some help. And I think this links again to that feeling of shame that so often neurodivergent people and families are made to feel ashamed of who they are and the support that they need and the ways that they're struggling. Somebody said that just because their child masks at school does not mean that they're coping. This is huge. I think masking is becoming something that we know more about and we understand better. But we do sometimes hear, oh, well, they're fine. They might be fine in one context. That doesn't mean that there aren't massive well-being impacts felt in other ways or internally. Our participants wanted people to know that not everybody is the same and stop thinking one thing works for everyone. They wanted us to know that it's far harder to be me than it is to deal with me. And this really hit me actually in my chest when I thought about this, because again, it links to that feeling of being ashamed of who you are, being told you are wrong and you are broken and you are a burden. And especially being in a situation that a lot of children who are neurodivergent find themselves in, where people talk about them in front of them. And that can be super frustrating, hearing people having conversations about you being a problem or being difficult. Somebody else said, we want people to know how much symptoms affect me all day, every day. Also, that I and many other neurodivergent people might struggle with some seemingly simple tasks, but have other skills that are really useful and to play to our strengths rather than focus on our weaknesses. And finally, somebody said they want people to know that there is no cure. This is our normal, so you should be adapting to it. So these surveys findings have been really interesting for us and really amazing, but we haven't just collected this information. We are trying to learn from it as a service and trying to build on it. So at Happy Talk, where I work, it's fab because we have a team with so much lived experience of neurodiversity. Many of our team members are neurodivergent themselves, or they have neurodivergent friends and family members. And we try to use our own lived experience to help us build our services. This means that we can empathise better with our service users and our families. It means that we can put ourselves in their shoes and really try and understand where they're coming from. We're also always learning and looking to understand more about our client group and about the people we work with. You know, I'm autistic and I have ADHD, but I'm not dyslexic. I'm not dyscalculic. I don't know how you say it. So I need to learn from other people's lived experiences when I'm working with people who experience this. There are a few things we've done with our feedback. So the first thing we've done is we've developed a neurodiversity affirming therapy policy, which all of our team members have read, follow and champion. It's important that anyone, when they start with us, has a look at this and thinks, this is the ethos that I am taking forward in all of my therapy sessions. We adapt our spaces to the sensory needs of our service users. We have all sorts of sensory toys available. We use adaptive seating. I will never say to a child, sit down on a chair. We can't work until you're sat at your table. Why should I make them do that? If they want to do therapy stood up, if they want to do therapy bouncing on a trampoline, brilliant, we can go with that. We're also developing our AAC pathway. AAC stands for Alternative and Augmentative Forms of Communication. There's loads of AAC providers here today. And we've been working with providers to try and support families to trial and access vital communication aids without being gatekeepers. We are not saying, prove to us that you can use PECS before we'll give you an iPad. We're saying, let's give it a go and see what happens. We are delivering neurodiversity training to partners and organisations across the Northwest, which has been really fantastic. We've got to meet and work with some amazing people. We support our families with evidence for their DLA applications, their EHCPs, and when they transition in and out and between services. We're also passionate about co-producing goals with families and service users and ensuring that we share our reports with the children themselves and with the families in an accessible format. We know that neurodivergent children often have neurodivergent parents. And so we try and sit down with our families and go, this is what we found about your child. How do you want us to communicate that to you? So what do we do for neurodiversity affirming therapy? Because I can talk about it, but it's good to give you some examples. So neurodiversity affirming therapy is therapy which does not seek to cure, fix, or change the neurodivergent individual. They are not broken. They do not need to be fixed. Instead, we value the person as they are and seek to build confidence, self-awareness, self-advocacy, and empower them to manage their own needs and to advocate for those needs in different settings. Neurodiversity affirming therapy must use co-production. Co-production allows us to identify goals, plan sessions, and choose outcomes that are meaningful for that person and their support network. In our sessions, we try to be very child-led, so we allow young people to choose which activities they want to engage with and at what pace. I'm not going to have someone walk into my therapy room and say, you must do this worksheet and play Pop-Up Pirate. Instead, I'll have an array of toys and activities available, and I'll let them choose what they want to do and what they want to talk about, and I adapt to them. We try and learn about young people's special interests and involve these in our sessions. So at the moment, I have a young man I'm working with who came in one day and he said, Polly, I want to play Dungeons and Dragons with you. Brilliant, we can do that. I love that. We sit down in our sessions, we do D&D, we have a great time, and we use that to work on his language, his conversation skills, and his communication. And he loves it. He engages better because it is meaningful for him. We try to avoid giving too many direct demands. We try and use indirect demands. We follow the advice set out by the PDA Society around this. We also champion and advocate for all means of communication, including AAC. Even for our service users who are verbal, we will still provide visuals in our session. We will still provide pen and paper. We will still give them other means of communicating that aren't just talking, because even if someone is verbal, that doesn't mean they're verbal all the time. That doesn't mean that that's the way they want to communicate with us that day. We use positive and identity affirming language, and we actually sometimes, where we can, ask the young person, how do you want me to talk about you? Do you want me to say that you're autistic? Or do you want me to say that you're neurodivergent? Or do you want me to say you've got a different brain? We try and co-produce, as I've said. When we write reports, we use strengths-based language, and we always talk about that young person's strengths, and we talk about who they are, what they enjoy. It might be, if it was about me, this is Polly. Polly really enjoys gaming and knitting, and Polly loves to talk about Buffy the Vampire Slayer. And that will be in the report to help people get to know that young person. We've also developed some self-advocacy programs, and these programs focus specifically on building lifelong independence skills and involving the young person in choosing those goals. I've been doing this with a young man at the moment. He's 17, and I said, what do you want to work on? He said, Polly, how do I order at a restaurant? Nobody's ever told me. So we've sat down, we've role-played that, we've talked to school about taking him into the community. That is an independence skill. That is something he will need forever, and no one's told him. So, and if I hadn't asked him, he wouldn't have asked me to help him with it. We also use sensory adaptations, movement breaks, and flexible sessions. We've got loads of sensory toys. We let our young people move around as they want to, and we adapt our session. I might say my session's an hour, but if that young person can't focus for an hour, I'm not going to make them. We do what we can when we can, and we are flexible to their needs. We should also consider the communication needs of the parents, carers, and school staff, as well as the child. Like I said, we know neurodiversity is genetic. We know that many of our parents will also need that kind of support, and we try and ask them what they need and help them to advocate for themselves and their child as well. So maybe you're already seeing a therapist, maybe you're not, maybe you're about to. How do you know if your therapist is neurodiversity affirming? The best thing you can do, honestly, is ask them. Go to your therapist and say, how do you affirm neurodiversity? Do you have a neurodiversity affirming policy? What do you do? And here are some specific questions you might want to ask around this. You might ask, do you value and listen to lived experience? And how do you do that? Will you ask me about the goals that I want to work on and actively involve me in planning these? Do you use positive and strengths-based language, or are you using a deficit-based model where you just talk about everything that I can't do? Do you value all means of communication, including AAC, and provide these as options in sessions? Do you use child-led or client-led approaches and child-led play? And does your therapy space meet my sensory needs? And if it doesn't, can you do something to ensure it does? Is it too loud? Is it too bright? Can you turn the big light off? It could be really, really easy adjustments that they should be able to make for you. But don't just take my word for it. Our clients have given us incredible feedback on our therapy services, and I'm really proud of all of this. It's not all about me, it's about all of our team. So again, I'll just read them to you. We've had someone say, I've never felt so heard. Someone said, some weeks I am the only person that my son will talk to. The fact he has conversations with you about Pokemon is amazing. This one's also amazing for me. I love chatting about Pokemon with this young man, and he knows way more than I do because I only know about the original sort of 2 generations. He can tell me all sorts about the new Pokemon. One of our schools said, the therapists share my vision for the school. The feedback from all of our staff is fabulous. Both therapists are held in such high regard. Someone said, I'm finding it really helpful coming to these sessions. Thank you so much. We also had a young man in one of our secondary schools say, you just get me, miss, because you've got ADHD too. And this is a young man who's reported feeling like most adults don't understand him. Somebody said, the sessions at Happy Talk are fantastic. The play space is really engaging and the staff are friendly and very knowledgeable. They do everything in a relaxed way, and they take the children's lead while still clearly observing and offering so much helpful advice. And you can see they genuinely love spending time with the children and care about them. And we were told that our therapists use identity-affirming language, take a strengths-based approach in everything she does. Her reports are detailed, positive, and tailored to each child's needs, with clear, meaningful goals that are co-produced with the child, where possible, staff and families. So that's me, that's us. I'm so proud to work where I work, and I'm so proud to be an advocate for neurodiversity affirming therapy. And I hope as we move forward, more and more therapeutic companies, more and more therapeutic services will start using this approach. If you've got any questions, come and find us at our stall just over there. We're just across from the ADHD theatre. There's also a little QR code there. That QR code will take you to the survey that I was just talking about. We would love to hear more about your lived experiences, about the lived experiences of people that you love and you care about. Please fill it out. Please tell us what you want to see. We also have an option there to leave your email address if you want us to contact you for a focus group or just a discussion about how you want therapy services to be designed better for you and the people you care about. Thank you so much.